Okay, this is a rural clinic, and I am going to be taking this video to show what care out near the villages is like. Most people have to walk miles to get to this clinic. There.
I think this is good that everybody kind of gets to see what. Yeah, because it kind of gives us an idea of what we're seeing. But it's laid out kind of like what we've got. I mean, it's
even like as you come sometimes, it's also good to remember because these ones will stay and continue to work with you.
Yeah.
Yeah. So the information on the care will be good.
Oh, it's
and even sometimes when you bring some of those, you can help them.
Yeah.
If you think, because that's how you help.
Yeah. Yeah, definitely.
This is
also
you
give extra medicines, maybe.
Although I'm going to help you think about this best. I don't know what the catchment area is. They need to discover the whole. They need to go this area in the hands of somebody who knows how to use them well. Right. There's only one. I don't get the idea that that's next. Everybody. Obviously, you know what it is. She's alone, and you see the number of people attending to use them. That's the way. You know what I mean? But I know I can't even know. She's an angel. So we'll see how much. Oh, that's cool. Attend to delivering matters. And everybody else, medical cases, surgical cases, nurses, obstetrics, guys, she does all. But you know how our training is, the nurses, it's really more of nurses, and your training is really so obviously a lot of things are in a mess. Actually now, there are two scales, they are not working. The scales we used to wear. And that's like the cheapest drug you have.
Y'all notice that?
This is
better than the alternative.
This is what I take the height of the and everything else. They identify from here the problem. And then they go in here. How it is here is that because she can't do all the work alone, we usually just get someone from the community to help out. Now you know that if she's not around, this one is not medically trained, but they, through experience, and they expose them to medicine, this sort of setup, so they become acquainted and they help out. Yeah, and they're very simple. Obviously, she can't attend to complicated cases, yeah, and things like that. But this is the setup. We don't have enough nurses, we don't have enough doctors, and this, she's never been through any training, so you know what the trouble is. So this is where they clerk the patients from. They take the histories and they examine the patients. This is the examination day. Right now, she's attending to these people. Now, obviously, there's a very big challenge with our pregnant women because we can't do ultrasound scans. And obviously, she can only do this much. She can't finish everything. You note that the mortality, the maternal mortality is quite high in Zambia for the same reasons. At the hospital, we are able to identify these things early enough, the problems, but here, it hurts, but it is. Right. Then,
thank you so much.
Thank you.
You could, do you want to ask her about that? The wait. They usually have something. I don't know what the setup is.
Yeah. We ask her to bring it here and they collect something.
I'm sure that's fine. That's fine. Yeah. So this is.
You gotta be smarter than the door.
The clock on the wall is actually not that right time. It's not. It's closer to 10 o'clock in the morning. morning. Apparently the battery's going out in their clock. This is the delivery
There's
room.
no one. There's no patient.
Yeah,
There's
I'm
no
backing
plan.
down so he can.
Yeah, there's no plan.
Delivery room.
It's a
Now what
two-bed
is this
thing.
here?
I think there must be vaccine because they usually keep them
That's where they deliver.
Yeah.
Just
Refrigerator
for vaccines.
some medication which needs.
They have some power in here, which is nice. This is the delivery.
So obviously, if you have 3 people delivering at the same time, you know what it means. One will have to be somewhere because we only have so much.
Does that happen a lot?
It has. Even at the biggest hospital in Zambia, the University Teaching Hospital in Lusaka, there's so many clients at a time that some end up delivering on the floor. It's a very common thing. And because I don't know what it is, but it appears people in the villages like these ones and shanty compounds, even in the cities themselves, contraception is not very well promoted. It's like everyone is giving birth anyhow. Anytime you find people, a 30-year-old mother with 7 children, 8 children, it's very common. And they come in almost every year or 2. Yeah. But you see, again, because they're not very well monitored, someone who's not trained is doing the antenatal mothers. I think it's unacceptable. But because of this, you find so many mothers dying perinatally, postnatally.
Well, my daughter just had a baby, and she had preeclampsia, and so she would have died if she hadn't.
Okay, in a setup like this one, probably they won't even. I doubt if they'll even do urine protein. They don't do urine protein.
Yeah, in a situation like this, she probably would have died.
Yeah. We receive a lot of them when they're very ill. They bring them somehow. Some people manage to bring them to the central hospital. Some really don't. Because there's no car. They have to wait. They will have to walk the whole way from here to that side. And if someone is bleeding, postnatally, they've just given birth and they're bleeding. They'll become halal chicken before they get there.
I'm sorry, what was your name again?
Lukama.
Lukama?
Yeah.
Lufunda.
Whichever is easy for you.
Okay, thank you.
Alright. So in the rural Zambia, it's pretty much like this one. This one is a clean, it's a pretty clean clinic. I think a rural health center, they take care of it quite well. Except we just don't have things to use. These are record books of the patient. They give them numbers. So each time you heal, you have a number that will fill your card from the down. Yeah.
That was broken? That one's broken too, that scale. It's important to know weight to be able to give drugs.
Thank you. I had it about when I was 6.